Migraines and depression. Migraines don't always come alone. In fact, many patients can develop other diseases, called comorbidities in technical terms. On the one hand, people with migraines have an increased risk of psychological disorders such as depression, generalized anxiety disorders, or bipolar disorder. On the other hand, migraines are weakly associated with epilepsy. But physical ailments can also be related to migraines. These include back and neck pain, celiac disease, gluten intolerance, and irritable bowel syndrome. There is a special feature in women who suffer from migraines with aura. They have a slightly higher risk of suffering a stroke or heart attack. Studies have shown that migraine sufferers are at increased risk for depression, especially women with migraines with aura. In addition, those affected by both diseases are more likely to develop a headache from drug overuse. The mental illness manifests itself through a variety of complaints. Typical for depression are a permanent depressed mood, lack of energy and listlessness, loss of interest. Physical symptoms such as insomnia, loss of appetite, or headaches and bulging pains are also signs of depression. Around 5% of people are affected by the disease. There are a number of effective therapy options. However, since many of those affected do not see a doctor out of shame or ignorance, they remain untreated. But how are migraines and depression related? Which disease causes the other? What are the causes and how can treatment look like? Scientists conduct research to find answers to these questions. The connection between migraines and depression can be explained, among other things, by metabolic changes in the brain. In both diseases, there seem to be imbalances in certain neurotransmitters in the brain. One of them is serotonin. This neurotransmitter is involved in the perception of pain and is often out of balance in people with depression and migraines. Because of this, patients with both ailments can possibly be assigned to their own subgroup for which their own therapies should be defined. When treating migraines and depression in combination, the doctor first tries to find out which illness came first. Because this should ideally also be the focus of the therapy. For example, if patients are depressed and develop a headache as a result, the primary focus of treatment is depression. Conversely, the affected person may fall into depression due to the constant fear and suffering from migraines. Then the migraines should be treated first.